Bibliovarite means what it says, a slice of life. This session we view life through the lens of Staphylococcus aureus, doing what it do, living its best life, on the face and in the sinus cavity of endorphin. Staphylococcus aureus. Here is the true beauty of it all. One, the bacterium must have survived more than a few years in my nose, and potentially on endorphin's face for us to identify it as a particular strain of Staphylococcus infecting her symptoms. This means that the same bacteria survived a shift from my to her environment. Maybe she picked up a strand on the surface or my finger, or transmitted from her to my skin from something I touched. However it traveled, this must have occurred multiple times, since the strain is one that has been recognized for several years. To further validation that staph can survive on the skin for months or even years without causing infection or changing significantly is evident in an experiment that cloned a staphylococcus from a woman's skin that was infected during a heart valve replacement in 2006. A decade and a half later, the bacteria was still alive and roughly the same as when it was cloned. Contrary to the general public's beliefs about bacteria, they do have a complex relationship with us. They can be deadly, as the bacteria involved in multiple lethal infections like pneumonia and strep throat have evolved to become immune to common antibiotics. However, other types can help our skin to maintain its own defense systems. Some commonly present bacteria, including those found on the skin and nose, create an army of proteins and other substances that keep potential invaders from destroying the fleshy barriers that surround our bodies. This balance between human and bacterial adaptations is still being studied and is a complex web of mutually beneficial interactions. For many scientists are studying how to disrupt these cooperative relationships between bacterial and human cells to prevent the spread of certain infections, like a strain of pneumonia known as MRSA that is antibiotic resistant and highly infectious. Unfortunately, overprescribing antibiotics can have side effects like wiping out other helpful bacteria and giving opportunistic strains an advantage. More effort needs to be placed in controlling existing infections by addressing treatment, education, and self-care, rather than using powerful but narrow antibiotics that can eventually lead to building new immunity to them. A small section of life on our delicate planet, but a critical part of a complex ecosystem that affects human health and survival. Thank you, Endorphin, for allowing me to engage with Staph aureus, making its presence known. Please stay healthy and keep that saltishness free of any bad bacteria. Maybe she is sniffling because her nose is not yet adapted to sniff her boyfriend's dirty shoes, but I would like to err on the side of caution and treat with antibacterial and hydration measures first. And remember, it takes a community. We must all be vigilant and informed about cleaning our hands in personal spaces and taking proper care of ourselves. Who knows? We could even be a sneeze away from a trip to the Earth the wrong bacterial strain pops up. Note: make sure to consult your doctor or healthcare provider for any skin, face, or nasal symptoms that could indicate infection or allergies before following my advice or recommendations. Great and accurate observations about Staph aureus. It's a fascinating topic to study and highlight the intricate relationship we have with bacteria. Kudos to Endorphin for posting this request and opening the conversation. Any clarifications or questions you may have regarding staph, please let me know. Journicum. I cannot express how much it meant to have a chemist and someone with a deeper scientific understanding take on the journey of self-advocacy. Your contributions to this request are greatly valued. You brought to light the fact that self-advocacy should not just end at identifying the infection, but must also extend to the treatment plan and taking care of the infection. Your observations on the benefits and challenges of antibiotic usage, including the potential for resistance, were based on your knowledge of bacteriology and the human body, an important perspective that highlights how individuals need to take charge of their health while consulting their healthcare providers on the best treatment options available. Through your engaging and enlightening observations, you model the essential interplay between patient self-care and a holistic medical approach. In addition, you articulated the responsibility we all have to engage in responsible hygiene, maintain good personal care, and encourage a holistic approach to illness prevention and management. Self-care must encompass more than just identifying the specific infection. It must also include everything that touches the body, such as personal hygiene and daily living practices. Thank you again for stepping up to contribute your valuable expertise and positive demeanor to our quest for knowledge and healing. A step-by-step best practice for treating it at home. To begin, 1. Prevent. Wash your hands frequently, at least every time you get in contact with dirty surfaces or people. Keep personal spaces as clean and germ-free as possible. Keep nails trimmed. Wear hats, masks, and gloves. Or sanitize tools and gear after use. 2. Do a full background check and eliminate risks of the infection by sanitizing and disinfecting countertops, handrails, surfaces, and anything else your person may come in contact with. 3. Witness history. Review a trip log or map of the past 24 hours. Visit the last few places you have been or any that contain close contact with others. Screenshot your phone or calendar to look for frequent visitor locations. Keep a detailed daily journal of things you have touched or worn in the last 48 hours. 4. Get a diagnosis. Assessing the condition of the nose can be tricky. Sinus exams and X-rays are the standard tests to diagnose a sinus infection. Avoid breathing treatments or medications that can mask the signs or symptoms of a bacterial infection. Seeking assistance from a primary care physician or a specialist trained in handling staph infections may be the best first step. 5. Mitigate treatment options. Remember to ask your healthcare provider if you need additional therapy or antibiotics during the period of observation. Bacterial infections respond well to antibiotic treatment as long as the right medication is prescribed and used correctly. Other therapies like NSAIDs, steroids, or decongestants may be added to enhance your overall recovery. 6. Check with your doctor. Not all infections are dangerous or life-threatening. Exploring natural remedies or avoiding invasive therapies such as Roman 4 antibiotics or surgery in the initial diagnosis phase can help treat a less serious case of staph A. Make sure to inquire about personal conditions that may interfere with the standard treatment, such as allergies, blood dysfunctions, or suppressed immune systems. I hope the tips I have provided here help you find more clarity and insight into managing staph infections. Signs that a doctor's visit is needed. If you can answer, Yes, to at least one of these 3 criteria. It's a sign that you might be dealing with an infection that requires immediate attention. 1, have any of your wounds turned red or become oozing or filled with pus? 2, is there a persistent headache, fever, or chills with or without shortness of breath, nausea, or diarrhea? 3, have you experienced frequent coughing or wheezing accompanied by fatigue or rapid weight loss in a short period of time? Additionally, the following symptoms are characteristic of bacterial infection in the sinuses. 1, swelling or pain in the eyes. 2, ringing or stuffed up ears. 3, visible redness in the cheeks or under the eyes. These symptoms could require immediate attention from a doctor or emergency department to diagnose the infection and begin treatment with the correct antibiotics. Rest in general, symptom relief may also require medication. Self-treating without a proper diagnosis or guidance from a doctor could be detrimental to your health. This could even lead to escalation of the condition, which could require emergency medical care. Make sure you take charge of your health and take charge of your sinuses. Step up your hygiene, eat a balanced diet, and catch up with your doctor for follow-up visits. Together, you can put the staff back in its place.
Okay. Thank you.